I am pleased to be joined today in the studio by Dr. John Krueger.
COVID-19, the coronavirus, remains the top story.
While we want the public to be cautious,
Dr. John Krueger is the Undersecretary of Medical Staff and Quality for the Chickasaw Nation's Department of Health. He spent time at KCNP Radio and CNTV to share important information about the coronavirus pandemic.
Why is this virus different? This virus is brand new to humans on the planet. The humans have never seen it and never had a chance to develop immunity to it like we have to other viruses.
It's a virus that is highly contagious with no current vaccine and no cure. That's why drastic measures have been taken: social distancing, self-isolation, business and school closures.
A virus spreads, and when it spreads, it doubles literally every number of days. So whatever you see in infected persons now, you're going to see a doubling rate for a series of days. And so we're going to have a lot more infected people. What we're trying to do by having everybody stay home, wash your hands, distance yourselves from other people as much as we possibly can and isolate ourselves as much as we can reduce the number of people that get spread to and slow down that doubling rate.
Dr. Krueger says these are the symptoms of coronavirus: low-grade fever as low as 100.4 temperature, cough, and shortness of breath or difficulty breathing. Signs and symptoms may appear 2 to 14 days after exposure to the coronavirus.
They hijack our cellular machinery and use that to replicate and make more copies of themselves. And then that's how they eventually spread. Even though this is going to be a trying time, it's going to go on for a while. How long? Don't know. I wish I had a crystal ball to tell everybody, but I don't. But it will probably be a little longer than we all wanted it to be, for sure. And so as all this is going on, one thing I know for sure is that Oklahomans and Americans in general do really, really well in disasters, and we tend to come together when things get bad. So I think this is a great opportunity to do that and have solidarity with one another and just take care of one another during this pandemic.